when we can.
Just to kind of say I'm quite disappointed that Mr. Harris is not here. He kind of seems to be the Scarlet Pimpernel of the Dáil these days. But my question to you, Minister, today is in relation to the families that have to leave this jurisdiction to obtain a medical cannabis licence in Holland. Obviously, it's a very onerous and very unworkable situation at the moment. So I'm waiting for your response. Thanks.
Again, I have addressed the reason that Minister Harris isn't here is because he is abroad out of the country. My colleague, the Minister for Health, is working towards the introduction short of a cannabis for medical use access programme. While the arrangements that will enable this programme to begin are being finalised, it is open to a registered medical practitioner to apply for a ministerial licence under the Misuse of Drugs Act 1977. Such a licence, if granted, enables them to legally prescribe medical cannabis for a named patient. It is important to note that the decision to prescribe such treatment is a clinical decision for the prescribing doctor. Until acceptable medical cannabis products are available for use in Ireland, patients who are the subject of a licence are obtaining their cannabis products from a pharmacy in The Hague. Under Netherlands government policy, cannabis oil products are not permitted to be commercially exported from the Netherlands. Notwithstanding the fact that such cannabis products might eventually be listed as products that could be accessed under the programme, unless the Dutch export barrier is removed, anyone who is prescribed these products will have to travel to The Hague to obtain them. The Minister for Health is aware that a UK company may provide a service which involves it collecting cannabis products from the Netherlands for persons authorised to use it under the UK medical cannabis regime. While this company can import medical cannabis products into the UK from the Netherlands, the UK authorities do not currently allow re-export from the UK to other countries, which includes Ireland. I have been informed that this UK company may be acting as the patient's nominated representative in the collection of their personally prescribed medical cannabis products. No similar Irish entity is known to provide this service, but it is certainly open to any patient to engage a representative on their behalf in this regard.
I'm sure you'll agree that this situation where people have to leave this jurisdiction to obtain a prescription is quite ludicrous. I can't think of any other medicine where the situation where a patient or a nominated person has to go to another jurisdiction and bring the prescription back. It gets even more ludicrous. There's a family, and they've given me permission to speak today. They're based in Newton Arts in County Down, and they're in a situation where they do not have to go to Holland to collect the prescription. A distribution company brings the prescription to a named pharmacy. So in the case of Vera Toomey, her husband went over to Holland in the last 2 months, and the pharmacy told Paul that the prescription could not be met for the next 6 months. So you have a situation where it is completely unworkable in the short term or the long term.
Ministers first.
Deputy, I can appreciate your consistency in this issue and your diligence in raising the difficulties that families are experiencing, and that is why we want to introduce a medical cannabis for access programme to bring about and to address it. But in the meantime, while we're bringing that about, we have to deal with the exigencies, or I suppose the difficulties and the challenges that are there with both the Netherlands law and the law that they have with regards to export it. And we recognise the difficulty that is proving for families, but until we get our own programme up and running, that's how we have to operate within that, in that existing system.
Okay, final question.
Like, for most people listening to this, they will really won't understand the 16 licences being granted to 16 individuals in the state. So you would think that the state would intervene and say, look, we can provide a distributing company that goes to Holland and brings it to them 16 individuals for them 16 pharmacies. That would be the logical thing to do, because at the moment the cost of reimbursing the travel and the inconvenience is very stressful on the families. But the substantial issue, Minister, here is the cannabis access programme and the proposed access programme, which has been muted for the last 2 years, and still it's not up and running. So you still have individuals having to go to their specialists, and the majority of the time the specialists will say, look, I don't know enough about this product and enough about this situation, so I'm not going to prescribe. So it's a very, very situation that's unsustainable and unworkable. The access programme needs to be up and running so people do not have to leave this jurisdiction and get the medication in their pharmacy and being reimbursed by the HSE.
I get the final response.
And I agree wholeheartedly with the Deputy, and we share the same desire here to have our own medical access programme in its entirety, as opposed to having a bit meal. And if we try and address, we can divert our attentions away to try and address it in a bit meal approach and address the issues that are there affecting here and now, or try and have our own programme, which I think would be a much more sustainable solution. And that's where we put our energies and our focus and our time and our effort into at the moment, is to develop that. We don't have an end date. There's a lot of issues, as you will appreciate. There's an awful lot of issues that we have to address by trying to bring this programme about. It's not that it's not been done. This is mentioned every month at our management meeting about the Department of Health. We get updates on the progress on this, but I don't have a timeline for when we actually hope to have it established in full. But you appreciate the number of issues and challenges that are there in establishing that for this country.